to this 4th annual Skunkworks. This is the event of the year. This year, you're going to be hacking chronic disease. Statistics Canada last year estimated that 45% of Canadians are currently living with one chronic disease or another. Innovation remains the best way to tackle complex diseases. Providence Skunkworks was established 4 years ago with 2 outcomes in mind. First, to introduce people to each other in the hope that there'll be new friendships and new collaborations developed. The second outcome was really to develop novel approaches to tackle the increasingly complex health challenges faced by the patients that we serve by bringing together teams of multidisciplinary people in an environment that is aimed to break down silos and to foster critical thinking, design thinking, and out-of-the-box thinking.
I believe so strongly that healthcare is about collaboration and coming together and understanding more deeply the differences that we have, but also the commonalities and the shared vision that we have.
I really do hope that some of the solutions presented today will be actualized and operationalized to improve patient care, especially for those patients who do not have access to healthcare in rural and remote areas, and also for those who have barriers to care such as language ability or disability.
I really love the idea of innovation within healthcare. As a patient, I've kind of been able to see gaps in care that I've experienced and wanting to provide that kind of perspective. My biggest takeaway is just feeling very heard and very excited about the future in terms of all the amazing people here that are so committed to improving the healthcare system and addressing these gaps.
We came up with the idea for a RAG chatbot, RAG being a technology where you pair a large language model with a database, and you feed that database and you populate it with the patient's data. So electronic health records, lab results, prescriptions, wearables data. You give the patient access to that chatbot, and when the patient asks the chatbot certain questions, the chatbot will reference the data in that database and personalize the response so that the patient can make really well-informed decisions about their healthcare.
Specifically, we decided to answer the question of how can we get people to take the stairs a bit more often? We're going to renovate and transform stairwells in Providence Healthcare into interactive, fun, engaging spaces where patients, visitors, and staff can improve their health and be encouraged to take the stairs a bit more and maybe learn something.
Our solution uses existing data within British Columbia to identify gaps in chronic disease care, and then produces reports such as this, which allow patients to understand their lab results. It gives them a stoplight approach to whether things are good, bad, or very worrisome, and then gives them some more information about how to interpret these results and then next steps that they can take to their physician to act on, or in this case, lifestyle changes to make on their own. So I think Winning gives us an opportunity to make this idea into a reality and hopefully help some patients who are living with chronic diseases generally and improve their lives.